There is an important conversation that most men over 60 should have already faced, yet almost no one is truly having it. It doesn't come up during routine doctor visits, it's rarely discussed among friends, and even in private moments, it is often avoided. The subject is uncomfortable, but ignoring it only allows it to grow into something far more serious over time. We're talking about the prostate, a small, often overlooked gland that quietly sits beneath the bladder, unnoticed until it begins to interfere with daily life. Many men dismiss early symptoms or assume they are simply part of getting older. Even some healthcare providers don't address it early enough unless clear problems have already developed. But this is where that silence needs to stop. I'm Dr. Sarah, a board-certified urologist with more than 3 decades of experience helping men maintain their health, independence, and quality of life as they age. Over the years, I've worked with thousands of men, fathers, grandfathers, husbands, and one thing has become very clear. Prostate health is not a minor issue. When neglected, it can quietly disrupt sleep, comfort, confidence, and overall well-being. But there is also encouraging news. I've seen firsthand how small, consistent changes in daily habits can lead to significant improvements. Simple adjustments, nothing complicated or expensive, can support prostate health and even change the course of how symptoms develop after 60. In this discussion, I'll guide you through 5 powerful habits supported by science. These are practical strategies you can begin right away. Some may seem surprisingly simple, but their impact can be profound. One of them, in particular, might completely change how you think about your daily routine. Before we go further, it's important to understand what's happening inside the body. The prostate is a small gland, roughly the size of a walnut, located just below the bladder and surrounding the urethra, the tube that carries urine out of the body. Its role is essential in male reproductive health, contributing fluid that supports and transports sperm. However, beginning around the age of 50, this gland often starts to enlarge. This condition, known as benign prostatic hyperplasia, or BPH, is extremely common. According to data from the U.S. National Institutes of Health, more than half of men between the ages of 51 and 60 already show signs of it. By the time men reach their 70s, that number rises to over 80%. As the prostate enlarges, it begins to press against the urethra, creating a series of frustrating and often exhausting symptoms. Urine flow may weaken, starting urination can become difficult, and the bladder may never feel fully empty. For many men, frequent nighttime trips to the bathroom become a regular disruption. What makes this more challenging is that many assume this is simply an unavoidable part of aging. But that assumption is not entirely accurate. Emerging research continues to show that lifestyle plays a significant role in how these symptoms develop and progress. One of the first and most effective habits to consider is something that appears simple on the surface but is often misunderstood: hydration. Specifically, how and when you drink water. Many men believe they are staying hydrated, but in reality, their pattern is inconsistent. Long periods without drinking are often followed by consuming large amounts of fluid later in the evening. This pattern places unnecessary stress on the bladder and disrupts sleep. As the body ages, the natural sense of thirst becomes less reliable. This means dehydration can develop without obvious warning signs. When fluid intake is insufficient, urine becomes more concentrated, which can irritate the bladder and increase inflammation in the prostate. This irritation leads to more urgency, more frequent urination, and poorer sleep quality. Over time, this creates a cycle. Disrupted sleep increases inflammation, and inflammation worsens symptoms the following day. However, this cycle can be interrupted with a simple adjustment. Research published in the Journal of Urology involving over 2,000 men aged 60 and older found that those who followed a structured hydration pattern, drinking more fluids earlier in the day and reducing intake in the evening, experienced a significant improvement. Nighttime urination decreased by 41%, along with noticeable relief in other urinary symptoms. Applying this strategy is straightforward. Begin the day with a full glass of water and maintain steady intake throughout the morning and afternoon. Instead of drinking large amounts at once, sip gradually. As evening approaches, begin to reduce fluid consumption, allowing the body time to process fluids before bedtime. This small shift may seem insignificant, yet it can dramatically improve sleep and reduce bladder irritation. Over time, it becomes a foundational habit that supports prostate health in a quiet but powerful way. Another habit that offers remarkable benefits requires nothing more than your own movement. Walking after meals. While walking is often associated with heart health or weight management, its effect on the prostate is less widely recognized. After eating, the body directs energy toward digestion. Light movement during this time enhances circulation, particularly in the pelvic region. This increased blood flow delivers oxygen and nutrients that support the prostate while helping reduce inflammation. In addition, walking after meals plays a crucial role in stabilizing blood sugar levels. This is especially important because men with insulin resistance or diabetes are at a significantly higher risk of developing prostate-related symptoms. Elevated blood sugar contributes to systemic inflammation, which directly impacts prostate function. A study conducted at the University of São Paulo followed men over the age of 65 who adopted a simple routine, walking for 15 minutes after lunch and dinner. The results were striking. These men experienced a 35% lower risk of developing moderate to severe prostate symptoms. The key here is consistency rather than intensity. There is no need for strenuous exercise. A gentle walk around the block, through the house, or even in place can be enough to activate circulation and support overall health. The third habit is one that many men find difficult to talk about, yet it plays a critical role in prostate health: regular sexual activity. From a medical standpoint, the prostate is an active gland that produces part of the seminal fluid. Without regular release, fluid can accumulate, along with cellular waste and inflammatory compounds. This buildup can contribute to pressure, irritation, and chronic inflammation within the prostate. Scientific evidence supports this connection. A long-term study conducted by researchers at Harvard, published in European Urology, followed more than 10,000 men over nearly 2 decades. The findings showed that men who maintained regular ejaculation around 21 times per month had a significantly lower risk of developing prostate cancer compared to those with less frequent activity. Beyond this, regular sexual activity promotes healthy blood flow in the pelvic region, supports muscle tone, reduces stress, and helps regulate hormones. These combined effects contribute to a healthier prostate environment. Despite this, many older men avoid the topic due to discomfort or outdated beliefs. However, maintaining sexual activity later in life is not only natural, it is beneficial. It should be viewed as part of overall health, not something to be ignored. For those facing challenges in this area, whether physical or emotional, it's important to seek guidance from a healthcare professional. There are options and solutions available, and addressing this aspect of health can make a meaningful difference. Ignoring it, on the other hand, often leads to greater problems over time. Regular, gentle sexual activity is not something to feel embarrassed about. In fact, it is one of the body's natural ways of maintaining balance and function. When approached with understanding rather than discomfort, it becomes a supportive habit, one that contributes quietly to long-term prostate health. Before we continue, if what you've heard so far has been useful, take a moment to support the channel by clicking the like button. It truly helps this message reach more people. And if this is your first time here, consider subscribing to Senior Vital Health. Our goal is simple: to share practical, science-based guidance that many men are never told, especially after 60. You deserve clear information, and we're here to walk that path with you. Now, let's move into the fourth habit, something you already do every day, but perhaps without realizing its full impact. Eating is not just about satisfying hunger or enjoying flavor. It can also be a powerful tool for protecting your prostate, depending on the choices you make. What you place on your plate has a direct influence on inflammation, hormone balance, and cellular health. Some foods gently support the prostate, while others, over time, can contribute to irritation and dysfunction. One of the most important compounds to understand here is lycopene. This antioxidant is naturally present in red-colored foods such as tomatoes, watermelon, and guava, with cooked tomatoes being one of the richest sources. Lycopene works by reducing oxidative stress within the prostate, helping to calm inflammation and protect delicate tissue. Research has consistently supported this effect. In one study published in the International Journal of Cancer, men who consumed cooked tomato products at least twice per week showed a significantly lower risk of developing prostate cancer. This isn't a complicated change. It can be as simple as adding tomato paste to soups or lightly roasting tomatoes with olive oil. Another key nutrient is zinc. This mineral plays a central role in maintaining prostate structure and supporting proper hormone regulation. Foods like pumpkin seeds, cashews, and oysters provide a rich source of zinc and can easily be included in regular meals. Zinc is especially important for how the body processes testosterone, helping maintain a stable internal environment for the prostate. Vegetables also deserve attention, particularly cruciferous varieties like broccoli, cauliflower, and cabbage. These contain sulforaphane, a natural compound that supports detoxification processes and helps protect cells from damage. Think of these foods as part of your body's internal maintenance system, quietly working to remove harmful substances and preserve cellular health. When you bring all of this together, a prostate-supportive meal doesn't have to be complicated. A simple plate might include roasted tomatoes, a portion of greens, a clean protein like salmon or tofu, and a sprinkle of pumpkin seeds. Even adding green tea can provide additional anti-inflammatory benefits. You don't need to overhaul your entire diet overnight. Start with one intentional meal each day. Over time, these small choices begin to create a meaningful shift in how your body functions and feels. The fifth and final habit is often underestimated, yet it may be one of the most powerful. It doesn't require effort in the traditional sense. No movement, no preparation, just the ability to rest deeply. Quality sleep is where much of the body's repair takes place. During the deeper stages of sleep, especially non-REM phases, important hormones are released. Melatonin and growth hormone, for example, are not only involved in sleep regulation, they actively contribute to tissue repair, inflammation control, and cellular protection. Melatonin, in particular, has been studied for its potential anti-inflammatory and protective effects within the prostate. Growth hormone supports regeneration and helps maintain a balanced internal environment. Together, they form part of the body's natural repair system. When sleep is poor or inconsistent, the opposite occurs. Stress hormones, such as cortisol, remain elevated, hormone rhythms become disrupted, and inflammation gradually increases. Over time, this creates conditions that can negatively affect prostate health. Long-term research has shown a clear connection. In a study published in Cancer Epidemiology, Biomarkers and Prevention, men with chronic sleep disturbances were found to have a significantly higher risk of developing more aggressive prostate conditions. The encouraging part is that improving sleep does not require anything complex. Creating a consistent routine can make a meaningful difference. A cool, dark room, reduced screen exposure before bedtime, lighter evening meals, and a regular sleep schedule all contribute to deeper, more restorative rest. Sleep is often overlooked, yet it functions as a kind of quiet medicine, working overnight to support the systems that protect your body. When you step back and look at everything together, a clear pattern emerges. 5 habits: hydration, movement, sexual health, nutrition, and sleep, each simple on their own, yet powerful when practiced consistently. They form a daily rhythm that supports healing from within. The most important thing to understand is this: aging does not mean losing control over your health. It means becoming more aware of your body and responding to its needs before problems develop. Each of these habits offers an opportunity, not just to reduce discomfort, but to restore energy, confidence, and quality of life. And that doesn't only affect you. It impacts the people around you as well. Your family, your partner, those who value your presence and your guidance. Because the goal isn't just to live longer, it's to live well, with strength, clarity, and the ability to fully experience each day.